Good evening. My name is Phil Bushby. I'm the Marcia Endowed Chair of Humane Ethics and Animal Welfare at the Mississippi State University College of Veterinary Medicine. And I'm also on the board for Mississippi Spay Neuter. I want to talk to you this evening about the importance of the Big Fix Clinic. Now, I assume that since you're attending this virtual session, that you already believe that the Big Fix Clinic is important. But let's look at the details. Let's explore why the Big Fix Clinic is so important, why it is necessary. Lack of access to veterinary care is becoming a huge issue in the United States. A study published in 2018 documents the problem. Are you aware that between 2016 and 2018, nearly 30% of all households with pets could not get veterinary care for their animals? They had limited or no access to veterinary care, and that includes spay-neuter. 29 million dogs and cats live in households that receive food stamps. Let's face it, if a family can't afford to feed their children, to put food on the table, do you think that they can afford to have their pets sterilized? The same study documented that 26.3% of dogs are not spayed or neutered, and that 17.9% of cats are not spayed or neutered. But this article is based on a survey of owners of dogs and cats. So that 17.9% of cats not spayed or neutered is really very artificial, very low, because it doesn't account at all for feral or community cats. The study also documented that pets living in the South were the least likely to be spayed or neutered. Excuse me, a more recent study published just a few months ago dissected the problem even further. Nearly 50% of dog owners indicated that the cost of veterinary care was a challenge. A majority indicated that they believed veterinary services were too expensive. The study also pointed out that those populations disproportionately affected by the cost of veterinary care included younger people, those with limited formal education, and those with an income less than $25,000. And they concluded that resources that provide low-cost care for veterinary services should be offered within those communities. So if so many people who own pets have concerns about cost, what about those animals that don't have homes? What about feral or community cats? What about animals that are living in animal shelters? A 2004 study, and I know that's 17 years ago, estimated that the number of feral cats in the United States rivals the number of pet cats. With over 80 million cats that are owned and living in people's homes, think about perhaps 80 million cats that are on the streets in feral communities. This study looked at the intake of feral cats at 7 different trap, neuter, return programs, and discovered that 53.4% of the cats were intact females, 44.3% were intact males, meaning 97.7% of the cats had not been sterilized. Only 2.3% had been sterilized. But it gets even a little bit scarier. 15.9% of the females brought into these clinics were pregnant at the time of surgery, and the average number of fetuses per female was 4.1. Imagine if all those females had all those kittens, which grew up to have more kittens, which grew up to have more kittens. So the Big Fix Clinic steps in to help address this problem. So let's look at the data. From 2005 to 2020, Mississippi Spay and the Big Fix Clinic have helped over 92,000 dogs and cats. At the Big Fix Clinic alone, from 2008 to 2020, they have sterilized 59,195 cats. Just last year, 2020, in the midst of a pandemic, they sterilized 4,338 dogs and cats. And what's the impact of that? Well, one impact is the reduction of the numbers of animals admitted to shelters. Look at the figures from Mississippi Animal Rescue League. In 2005, the intake, the Animal Rescue League, Mississippi Animal Rescue League, was 17,000 animals. In 2019, it was 9,860. A little bit more than half what it was just 15 years ago. So the question is, could the Big Fix Clinic do more? And the answer is absolutely. It all depends on funding. Please realize that not all costs of running the Big Fix Clinic are covered by spay-neuter fees, and that grants from humane organizations and foundations are becoming much more difficult to obtain. And oh, by the way, rescues that trap feral cats have very limited financial resources. So that's where you come in. Donations are vital to continuing the work of the Big Fix Clinic. Donations are vital to the possibility of expanding the work of the Big Fix Clinics. The dollars you contribute help those people who cannot afford to sterilize their pets. They reduce the size of feral cat communities and improve the health of feral cats. And they reduce the intake and euthanasia of dogs and cats at local shelters. The full impact of the Big Fix Clinic is only limited by the money they have to operate. The greater the level of donations, the greater the impact. It really is as simple as that. I've put up on the screen references to the Access to Veterinary Care document that I referenced right at the start of this presentation, to the article on demographics that I also referenced, and also population characteristics of feral cats. Any one of you that wish to explore those issues further, these are the references. Thank you very much, and thank you for your support of Mississippi Spay and Neuter and the Big Fix Clinic.